Hi, everybody. Welcome to another edition of the NutraStrong podcast, Campside Fireside Nutrition. We are thrilled today to be joined by Dr. Vivek Lai, who is the founder and CEO of ResBiotic. In addition to that, he's also the director of the Lung Microbiome Lab and a medical doctor, physician, and scientist at the University of Alabama at Birmingham. So hopefully I got all the words right and all the titles right there. And it's great to have you today. And just in full disclosure for the audience, as we always do, ResBiotic, the company that you founded and are CEO of, is a client of Nutrasource's, and we're very thankful for that. So welcome, Dr. Lai, to the podcast. Really appreciate your time today.
Thank you, Will, for inviting me on this podcast. Glad to be here.
Super. Now, tell us a little bit about yourself and your background, medically, academically, and then what led you to founding ResBiotic, and what is ResBiotic all about?
Absolutely. So I'm a physician, an ICU physician by training, and a pulmonary biologist by research training. I am an entrepreneur at heart and have been involved in a few businesses in the past several years. But ResBiotic came about from years of research in our lab at University of Alabama at Birmingham. Both my lab, which is a lung microbiome lab at University of Alabama at Birmingham, and our chief medical officer, Dr. Gugger's lab, which is a program in protease and matrix biology at University of Alabama at Birmingham. So we have been studying the role of microbiome and lung diseases for the last 10 years or so. Since the beginning, we have looked at the molecular mechanisms of how the microbiome affects lung diseases. Later in the phase, we got into the gut-lung axis and then explored how the gut bacteria actually communicates with different organs of the body, specifically lungs in our case, and how modulating the gut bacteria actually creates an effect in a distal organ such as lung with respect to general structure, function, and disease states. So that's how ResBiotic came about as a spin out of University of Alabama Research Labs last year. It was more, merely a coincidence that it did, come in a timely fashion where the world is actually worried about the lungs.
Yes. Yeah. You're horrible for humanity, but good timing otherwise.
Yeah. And if anything, the pandemic gave us some time to reflect and actually fast forward our R&D and commercialization processes.
For sure. And then, so when we talk about microbiome as relates to the lung, this is because we hear about skin microbiome, vaginal microbiome, and what you just described for us there. You're talking about how the gut microbiome influences the lung activity or lung health in some way. There's a correlation there. There's some communication there. How does that communication occur? I find that pretty fascinating. How do they talk to each other?
Great question, Will. So first and foremost, one of our first studies was actually looking at microbiome at birth, the lung microbiome at birth. We had the questions in mind whether a lung microbiome actually exists, does it exist at birth, and what role it plays in health and disease, and then where it comes from. So in our initial human study, most of the studies are done at the bench and then go to the bedside, but ours started at the bedside with an observation that a microbiome in the lungs actually exists. It is low biomass, but it is actually present, and as early as when a baby is born. Over the future months to years, this microbiome evolves. And as I said, the lung microbiome is a low biomass microbiome, but it does play a role in several diseases. Now comes the gut-lung axis. How does gut microbiome affect the lung microbiome? As you know, we are nothing but a bunch of bacteria. There are trillions of bacteria in the body, and all these bacteria in the gut regulate the immune system. And again, I have to choose my words carefully. As you know, it's a pretty regulated field, but they do create a immune regulatory mechanism in the gut where metabolites are produced, fiber is broken down in a specific way, and there are molecules or exosomes released in the blood which can affect the distal organs such as lung. So, in our research, we have found that just a mere dysbiosis of the gut can create systemic, cytokines and other things which can cause inflammation in the body. And uh, uh, probiosis, or fixing that dysbiosis, or fixing the diversity of the gut bacteria with specific bacteria which actually create metabolites or break down fiber more effectively to create substances which then go systemically through the blood to the lungs and other organs, affect your lung health. In addition, on a constant basis, we are aspirating gut content. There are micro aspirations all the time. So directly also the gut microbiome could reach the lung and change the lung microbiome. Okay. So
Yeah.
that's in general the premise of the gut-lung axis. A lot of research is being carried on about the gut-lung axis, both at our center and now around the world. We are just fortunate that we started early and we, have been looking at it, and this seems to work.
And then obviously with the gut microbiome, fecal analysis is one of the easier, straightforward ways to look at changes in the microbiome, the gut microbiome and its diversity. How do you test the lung microbiome, or can one test? How does the bioanalysis work to determine if the diversity is the science even that advanced yet?
Yeah, so again, great question, right? So gut microbiome, people have been sequencing, doing the 16S sequencing and shotgun sequencing, metagenomics in the stool. So lung samples are available for microbiome analysis, albeit they suffer from some sampling problems. So in infants, you can't get sputum, so you have to get tracheal aspirates from the sick babies who are intubated. In adults with lung diseases, sputum could be one option. Other option could be getting a bronchoalveolar lavage from the lungs and then testing that for the microbiome analysis. There's always a question whether it is the upper airway microbiome versus a distal lung microbiome. There are several studies carrying on, and then they have conflicting results whether the upper airway microbiome and the lower airway microbiome are similar. But bronchoalveolar lavage, sputum samples, tracheal aspirates are some of the samples that you can actually collect and check for presence of a microbiome similar to the stool. As I said, it's a low biomass, so you have to do rigorous quality control in determining whether it's a contaminant or actual microbiome signature. You have to adjust for contamination. You have to do, a more rigorous kind of analysis in lung microbiome. And now people are coming out with actual protocols and recommendations on how lung microbiome analysis should be conducted.
So the development has a lot of momentum. Things are getting published. Stuff's underway, but there seems to be a lot of work yet to be done. We're not quite there yet in terms of this is how it's done specifically.
Yeah, actually, this has started in the last 7 to 8 years, and in the last 3 years, I'm seeing a publication almost every month or so coming up about the lung microbiome. People are getting increasingly interested in it and fine-tuning the processes around testing of the lung microbiome. Again, poop is easy to get, lung samples are not, so that's always a problem.
Yeah, no, for sure. That's why I was so intrigued by that. And then when it comes to the science around which forms of probiotics or bacteria favorably impact the lung microbiome, or that communication between the gut microbiome and the lung microbiome, what are some of the key things that, if you're able to share, you've discovered along the way?
Yeah, and again, I'll share the more common things which are out there. One of them being an increase or decreased diversity is associated with chronic lung disease. A decreased diversity both in the gut microbiome and the lung microbiome is associated with chronic lung diseases. We also know that a preponderance of proteobacteria, that are the bad bugs, is associated with, and I use the word associated because, of course, you can't definitely call it causative, but a dysbiosis with increased proteobacteria is associated with chronic lung diseases.
So with all your background, your knowledge, and seeing patients on a daily basis as you do, I don't know how you do work-life balance, by the way, but congratulations. That's a lot going on. But
well, I always tell my team sleep is overrated, but that's not really true.
Yeah, it's part of immune health as well, for sure. But how then, when you then founded ResBiotic and you thought about the types of products and formulas you wanted to build and put together, how did you take all those learnings from your lab and from the ICU and your medical practice into formulating your products?
Absolutely. So, as I said, this was a little non-traditional way of actually, starting a company. We started from the bedside. We started with bedside observations, then went to the labs, created the mouse models of dysbiosis, created the germ-free mouse models of dysbiosis, did several in vitro dysbiosis lung models and specific in vivo dysbiosis mice models with monocolonization, polycolonization. We even created some humanized mice models where you would transplant the lung microbiome from humans into mice and then create disease or not create. And those some of those publications were not published yet, and they're now in publication just because of IP reasons. They were not published earlier. So it was a rigorous, as I said, 5 to 7 year process where we went from bedside observations about the presence of the microbiome and the presence of the dysbiosis, characteristic dysbiosis, translated that into the mice models and tested specific causation, gain of function or loss of function with a dysbiosis, and then therapeutics with specific probiotics of choice, whether that creates a difference in lung disease models. And we found robust differences. Then from there, took out the technology out of the university and commercialized it using the best, bacteria manufacturers, best contract manufacturers, and created a product which was launched last week as a ResB lung support. And again, it's a supplement product, but and I would like to stop there making any claims about the product, and I would let the product speak for itself in the months to come. But we're very proud of what we have created based on R&D, because not only it's the first respiratory probiotic that we have created, but I think it's one of the very few actual science-backed products out in the market where, the market, the shelves are full with probiotics, but not many are actually science-backed. And we have 4 major clinical trials planned or ongoing at this time on the product itself. Each and every bacteria strain is clinically validated, used in several clinical trials. All the bacteria strains are generally regarded as safe GRAS and have been, manufactured and bottled in GMP conditions.
Super. And one of the tough considerations with probiotics in combination or as a standalone is always counts. And what is the dose level? What is the amount per serving that an individual is getting? So how did you take the lung microbiome science and translate that into how many, what are the counts for the probiotics in your product?
Good question. So as this is a gut-lung axis product, we had certain counts we trialed out in animal models to come up with a count which makes sense to us. But the bigger challenge was, how do you preserve the potency after the product is made, right? Especially if you're starting a new product. So we have gone with, on the higher side of the counts, we have a label claim of 15 billion, CFUs.
CFUs, yeah.
And we are selling it as a refrigerated product to actually preserve the potency of the strains.
Okay. So that's part of the directions for use, or how a consumer interacts with the product, is to have it refrigerated.
Yes, have it refrigerated. We ship under refrigerated conditions. Again, as you can imagine, it takes a lot of investment and resources to create the supply chain for a refrigerated product. And we have created logistics center of our own here in the US for this purpose. And we ship under refrigerated conditions, and we recommend that the consumer stores it in their refrigerator, the dosage is 2 capsules a day, morning and evening, because that is what has been studied in clinical trials, and those are the doses which are being tested in ongoing clinical trials also.
Interesting. And then that's very unique in the field too, to have probiotics under refrigerated conditions all the way through the supply chain to the consumer. So good on you for your team setting that up. That's an important consideration.
Yeah, and again, we had to make the decision whether we invest in this. But for us as a company, our USP was quality, USP was R&D. We wanted to preserve the quality, and efficacy and quality comes first for us. So yes, that took a lot of logistics and time to design the infrastructure around it, but we wanted to do the right thing. So yes, potency and efficacy are of utmost importance to us, and hence the product is refrigerated.
And then with the lung microbiome, or products that people are taking in relation to that general area of wellness, what are some of the differences that, or maybe there aren't any differences, but male versus female, different demographics, is there an optimal time where they should be started? Are they good for all ages? What is sort of the general thinking on that?
Great question. Again, I think the first message here is the probiotic strains that we are using have been used in gut health a lot. So we are not even claiming that it helps, gut health, because for us, that's, taken for granted kind of a thing.
It's almost a given, yeah.
Yeah, so we know, even in our early, customer feedback that we're getting, people have great gut health benefits in addition to immune benefits. Lung health benefit is extremely specific to our product, and that's why it's a proprietary mix. We have gone with a proprietary mix of bacteria and botanicals, all studied in the lab and humans. And creating that special blend has, specific lung health benefits in addition to the existing gut health and immune benefits. Talking about sex predilection, we don't have enough data to say that men or women benefit one more than the other. We do know that the product has not been tested on kids, so we do recommend kids not taking it. On that note, we have infant second product under R&D and development, which should be launched in the next 6 months, which will be again a science-backed, first of its kind, infant probiotic supplement, which is actually created by experts in the field.
Super. And then demographic, age-wise, I guess it's never too late or too early to get started as an adult on these products, correct?
Yeah, our running joke at the company is, who is the target consumer? Anyone who breathes. That's what we say. But adults who are worried about their lung. There have been a lot of talk about who is a lung health consumer. It's not the patients who actually have lung diseases, right? Anyone who wants to breathe healthy. These are the times of wildfire, these are the times of pollution. Anyone could proactively now have a product to support their lung structure and function, and look forward to what could happen in the future. So long-term benefits, proactively. That makes anyone who is an athlete, who is a smoker, who has lung disease, or who is just concerned about the lung health, a consumer. We say adults, and again, it has not been tested on kids or pregnant or lactating women, so we do have it in the label that they should avoid.
Understood. And then as this area of science continues to build momentum, you said started approximately 7, 8 years ago, and it's really picked up the last 3 years. What do you see into the future, some of the different applications, obviously without giving anything away in terms of future plans for the business, but what are some of the general trends in this area of the gut-lung axis, the lung microbiome, in the research and academic area and medical field?
So ResBiotic is a supplement company, as you know.
Yes.
ResBiotic was founded by actual physician scientists who have a pharma company called Alveolus, which is developing state-of-the-art direct lung administration of LBPs. So I think the future could be direct inoculation of LBPs into the lungs. From the gut-lung axis perspective, I'm really intrigued by the microbiome, the fungi, how that affects the bacteria in the, because we say microbiome and then talk only about the bacteria, but there are the viruses, there are the fungi, that there are bacteriophages which affect. So it's an inter-kingdom relationship which has to be delineated in the years to come. Both at our center, some of our advisors, our group, and some of the players nationally are testing the inter-kingdom interactions. And that, I think, could be an interesting interesting aspect to study in the years to come. Again, it's very early, but how does the microbiome or how does the virome interact and affect the microbiome or the bacteria in the gut, and how all of these three affect the host individually and in combination.
And then how does one control for dietary intakes of the average consumer? That's always intriguing to me when one launches a probiotic and you're dealing with general population consumer. How does one adjust or account for the individual dietary intakes of the consumer?
The short answer is you cannot, right?
Okay, yes.
So I think the reality is you cannot control what the consumer is eating. You can only recommend. We do know a diverse variety of food does increase your diversity of bacteria. We know that increased diversity of bacteria is associated with better outcomes in general in human health. Plant-based diet has been recommended by many and has been shown by some to increase the diversity of the microbes in the gut. So that is something people could consider. But there are several associations listed with diet and benefits as per the microbiome of the gut goes. There are no specific causation or causative relationships that I would want to cite.
Very interesting. And then the other piece of this is on the exercise front or the physical activity front. How does that bolt on to, if one is taking this sort of a dietary supplement as part of a wellness, like a self-empowered, self-administered wellness program, there's the supplement piece, then there's a diversity in diet, more fruits and vegetables, which is something I've heard my entire life. And I think will continue, and I think the science continues to support that in general. But then when it comes, you mentioned sports nutrition earlier as a potential consumer target amongst many. How does exercise integrate into that picture as it relates to the gut microbiome, the lung microbiome in this area of health?
So we know that exercise influences the microbiome. So there have been some studies around that. So there could be indirect relationships of people who actually exercise, have different dietary habit, and that could influence your gut microbiome. But that's why I say these are associations. We don't know if it is causative. For a causation, you'll have to actually do a randomized control trial, placebo control between people who exercise and who don't exercise. Not many of those have been conducted. So that's why I keep saying it's an association that yes, exercise probably increases the diversity of your microbiome and helps indirectly in health and disease. But again, I don't want to, being a scientist, I don't want to tell you that it is a direct causative relationship, but there is an association with better microbial diversity with exercising.
And that's in the lung microbiome as well?
Gut microbiome. Again, lung microbiome is pretty early. Yes, in the next 5 to 6 years, people will start studying the exercise in relation with lung microbiome.
Okay, no, that's great and interesting to know. And then in terms of ResBiotic specifically, you talked about, having launched the first product last week. Congratulations. You have the next product coming out. For whatever you can share, what are sort of the future business plans going forward as you expand?
Yeah, so we have a direct-to-consumer arm which has just launched. The business plan does include B2B, B2B network formation and more business development. We would like to expand our international operations here soon, but again, we are trying to do it right and trying to do it absolutely in a science-backed, quality-controlled way, and hence it will be a phased launch. So the first phase is direct to consumer through our website and some of the online e-commerce channels, which has just started.
And is that your own website or is that through a platform?
So it's our own website, that is www.resbiotic.com, RESBIOTIC, resbiotic.com, which is a pretty user-friendly way to order. It's both a one-time order and a subscription model, because we do recommend that people try it for 60 to 90 days to see actual, effect. Although our customers have started seeing gut beneficial effect as early as a couple of weeks, 1 to 2 weeks in the feedback that we've received so far. So we both have a subscription model and a one-time purchase model.
And right now it's available in the US specifically, correct?
At this time, it is available in the US, and international sales would be launched very soon.
Excellent. Okay. And then switching gears and putting your medical doctor hat on for a moment, physician-wise, switching gears completely away from business in this area of science, in terms of lung wellness with COVID and the coming out of the pandemic, or hopefully the tail end of the pandemic here, depending on who you talk to. What are some of the general observations you're seeing from a health and wellness perspective for people to be enabled and feel empowered for their own wellness? What are some of the things people can do other than those we've already discussed today?
I think the consumer today is very informed. There's a lot of sources of information on the internet, etc., that people read and are more empowered and more knowledgeable. They are concerned about their health. The problem is there's a lot of information out there which is not validated, and people do get, biased information online. People are moving towards natural products. People are moving towards holistic approaches in addition to, pharmaceutical approaches to their health. And, in a way that makes sense, that nothing comes without a cost. So many of the pharmaceutical drugs would come with some side effects, etc. But I would like to make a point that nutraceuticals, such as supplements, are not to replace your medicines.
Right.
These are supplements for a reason. These are not FDA approved drugs. So people are moving more towards natural products, and I think it's a move in the right direction.
Very good. Well, Dr. Lal, thank you so much for your time today. I know you're super busy, wearing multiple hats day in, day out. Really appreciate ResBiotic as a client, and really appreciate the insights you shared with us today. Thank you so much.
Appreciate you inviting me here, Will. It's been a pleasure. Thank you so much.
Thank you.